Welcome to New Europe Studios, where you can watch us make the news. Today we have Peggy Maguire with us, who's the President of the European Public Health Association and also the Director General of the Europe Institute for Women's Health. Now, Ms Maguire, health has been a very big issue in European politics recently. We've had, as you all will know, the Tobacco Products Directive, and of course the effects of austerity is now beginning to be seriously questioned for its effects on health. So, Ms Maguire, could you first of all let us know, from your association's point of view, how has austerity affected people's health?
Okay. Well, as you know, the European Public Health Alliance is an organisation promoting public health in Europe and also emphasising the protection of public health in Europe. We've noticed over the last 5 years that with austerity that has had a major effect on European populations, the lack of finances, unemployment, and the stress levels in all countries, not just in one particular country, but in Greece, in Ireland, the UK, Eastern Europe. It has caused major health problems for people, and this is an issue that we need to address now in the 2020 review.
Okay. I mean, one of the things that's happened with health and public finance is that it's affecting it in so many different ways. It's not just something's being cut or suspended. It's that every single little piece that makes up the health process is being affected.
Absolutely. And we're very happy that yesterday when the Commission launched its communication on the midterm review of the 2020 strategy, now we all have to start working and looking at this strategy to see, currently, for example, the strategy doesn't contain a health component whatsoever. We really need to strengthen this health component, and we would ask the new members and the candidates for the European Parliament to address this issue and to ensure that we do have a 2020 strategy that is protecting the interests of public health in Europe. It's so important for everyone.
This is very timely, and I notice here that we've got your manifesto that you've just released.
Absolutely.
Could you tell me a little bit about the manifesto and what you're looking for from the candidates?
Okay. Well, as I said, we are asking MEP candidates to, when they're revising the 2020 strategy, to ensure that we have a strong public health component in the strategy and to protect the interests of public health, and that any future trade agreements, for example, should not be anti-public health measures, and we should protect these in the future. Also, the midterm review of the 2020 strategy recognised the strong contribution that health has made to social cohesion and also to economic productivity. So in this review there is going to be an assessment of the adequacy of, for example, pensions, social protection and healthcare, access to healthcare, particularly to high quality healthcare. And unfortunately, when we're looking at this, all they have actually provided as tools is structural reform. So that's reform of pensions, of healthcare systems, of social protection. And when we're looking at reviewing these systems, we need to ensure that we are doing it from a people-centric position that's evidence-based, that we can ensure the health of Europe, not just that we can have sustainable growth and economic growth, but that we have good health. And really what we're saying is it should be growth for health, not health for growth.
Well, we've heard all types of growth being offered as a magic solution by the European Commission, of course. But I think we can all understand ourselves that health is a part of our lives, it's a part of our families, and it's one of the foundations of our societies and of the original vision for Europe. Now, I mean, how far behind are we now because of austerity, the recession, perhaps the effects of a troika in some places? How much ground have we lost on where we should be?
Well, I think this mid-term review gives us an opportunity maybe to rectify what's happened. We have to recognise that the economic model that we used prior to austerity just didn't work. So we have to look at alternative growth models that include the social dimension and have the social protection alongside the single market, so that we can have look at social enterprise, looking at communities again, that communities have the power to maintain their own enterprises and maintain social cohesion at local level. I think what we have to remember is that most of the factors that affect health lie outside the health sector. So in this review we have to look at agriculture, we have to look at enterprise, we have to look at the TTIP and make sure that we have a health impact assessment in all other policy areas. Now this is a huge issue because even though the European Court of Auditors did a report and looked at a health impact assessment, there was no systematic inclusion of health impact assessment in other policy areas like housing, etc. and education. And when you think about it logically, if we're looking at social cohesion and we want real social cohesion and sustainability in the future, we have to look at communities, we have to have them sustainable. We need good transport, housing, good nutrition and education. Otherwise we're going to increase inequalities. And we are happy to say that the Commission yesterday, when they announced the communication, actually recognised the growth in inequalities. This has to be addressed, and we can only do this by having a strong health and social component in the 2020 strategy.
And of course, I mean, all of the links with these things like housing, like levels of payment, ability to be able to shop for fresh food.
Absolutely.
This is not controversial. This has been known and documented.
It has been known and documented. We have all the evidence base there. The research has been done. So let's take this research and apply it. When you think, we have all the evidence there, for example, on alcohol, on the abuse of alcohol, on tobacco, on nutrition. So what we will be calling on the members of the European Parliament candidates and the new legislature 2014 to 2019 to take cognizance of the fact that we need a new alcohol strategy, nutrition strategy, obesity strategy, HIV and AIDS strategy. And we need to look at these things concretely and make sure that they are introduced. For example, on Monday, the European Parliament Environmental Health and Food Safety Committee will be voting on a resolution for the new for alcohol strategy, and we would encourage members of the European Parliament to vote for this resolution. Alcohol is a huge issue throughout Europe, and I think it's the 9th cause of ill health and death in Europe. So we need to address this issue across the lifespan. Binge drinking in the youth, pregnant women and fetal alcohol syndrome, and throughout the lifespan, and older people as well who are living in isolation who may take alcohol as a companion, for example. So we need to address all of these issues in the new 2020 review.
And finally, just to ask you the $60,000 question, of course, is there is a move within Brussels, as it were, to move away from austerity and on to something else. And there is a growing recognition of that, the harm that has been done through the financial crisis. So it could be said that this appeal that you're making now is very timely, but it's also timely because it's a time when minds can be changed. Is that how you feel? Do you feel optimistic?
I think you always have to feel optimistic when you're working in the NGO world, and the European Public Health Alliance, as we said, we represent such a diverse group of people, health professionals, social groups, patient organisations, academia, and we do try to work all together, that not just patients and citizens, but also health professionals and workers will be included in any type of new Europe that emerges. Because what we want to be proud of a new Europe. We want a model of Europe that is for the citizen, that is citizen-centred, that looks after and the needs of the citizen, and we need an economy that's driving health. Because health is not a byproduct of economic growth, it's a component. It's a serious driver of economic growth. So that we need to make sure that we have a very healthy population with workers that are in good employment, with good employment rights, and that we can, and if we want to meet the targets of the 2020 strategy, employment for 75% of active citizens, we need to address the social issues, for example, like fair employment and rules and the rights of the worker as well. And also, of course, as well, that we can reduce, from an education perspective, we can reduce the dropout rate by 10%. So these are all targets that have been set by the 2020 strategy. But if we are to meet all of these and take 20 million people out of poverty, that's another target. We need to look at it from not just from a holistic approach, not just from the economic model. We need the social and health model as well. We need a strong health component in the new strategy, and we are encouraging and asking MEPs to support us in having a strong component in the 2020 strategy.
That's great. Thank you very much, and I hope we can all agree that a new Europe, it will be a healthy Europe.
I hope so.
And that New Europe Studios will support those who are looking to help those who wish to live a healthier, happier and better life. Thank you very much, and thank you.
Thank you very much.